Now I'll show you. Now I'll show. I will now show you the modified Psoas stretch. For this stretch, we will have the patient lay on their back in the middle of the table, and we will have them try and relax their knees and their stomach as much as possible. We will then ask the patient to place their finger on their belly button, and we will ask them to place their other finger on the crest of the bone in their pelvis here. Once they do that, you will go halfway between those 2 points, and that will be where you contact. So you'll want to start slightly outside of that, push down and slightly inward so you end up in the middle of those two, and you'll end up on the psoas muscle. Remember that this will often be tender for them, so you want them to let you know if it's more than a mild pain. Does that hurt? Okay. Is that a mild pain?
No, that's a little more.
Okay, then we'll lighten up some. Is that better? Okay, so you want it to be a pain for them that's maybe a 3 out of 10. Is that about a 3 out of 10? Then I'll just hold it. They can relax their hands once you've found that. You'll take your one knee that's by the table and place it between their buttocks and foot to help stabilize you so that it eases the pressure on your back. You'll have the other weight of your body on your leg that's standing, and between those two it will make it easier for you posturally rather than being bent over like this the whole time. This will let you be more erect. You will also take your hand and place it on their knee, and then push their knee out against you lightly and have them rest it against you. The contact hand on their abdomen is the one that will tell you if the muscle is letting go or not, and also the patient can tell you. So this would be the start position. I would then have the patient push slightly in with the knee to the center, and then relax. Push lightly in again, and relax. They'll actually feel the muscle tighten under your fingers as they do that. Did you notice that? So push in again lightly and relax. As you do that, you'll feel the muscles start to let go. Push in again, relax. It'll usually take about 5 times at this speed to get it to relax. It may take you 7, it may take you 4, but somewhere in that range. As you do that, you can ask the patient, let me know when you feel like this does not hurt anymore and like it's relaxed. Does it feel relaxed? And then you'll be done with it. Then you'll go around to the other side, and I'll show you from the back side. So I'll place my knee between the heel and their buttocks so it helps support me and I can be more erect rather than bent over. I'll have her put her finger on the belly button and the other one on her hip bone here, and then I'll go in between. Once I've found that place in the middle, I'll come slightly outside of it, and then I'll go down at an angle like this, 45 degrees, down and inward, and they'll feel that point where it's sore. I'll then bring the knee here against me, and then have them push slightly to the middle, and then relax. Remember, the hand that's pushing on their abdomen should only be causing a 3 out of 10 pain. Is it a 3 out of 10? Okay. Push in, relax. Push in, relax. You do it about this speed of a slow count of 5. Push in, and then relax it. And it will usually take around 5 to get it to let up. You should be feeling like that's letting up, is it? Does it feel okay now? Of course, Kristen has a phenomenal pain threshold, and so nothing hurts her anyway. And then relax it. That's the modified psoas.